Hello everyone, how are you? I hope all of you are fine. So today we are going to discuss on the topic myopia, which is also known as short-sightedness, and it is one of the common refractive error. It is kind of refractive error where parallel rays of light coming from infinity are focused in front of the retina when accommodation is at rest. So talking about normal eyes, the rays of light coming from infinity are focused in the retina when accommodation is at rest. But in case of myopia, rays of light are focused in front of the retina. So to correct this type of refractive error, generally concave lens is used. So talking about etiological classification, there is axial myopia, which is very common, and there is increase in anterior posterior diameter, and another one is curvature myopia, which is mainly due to increase in curvature of cornea or lens, and another is index myopia, which is mainly increase in refractive index of lens, that is seen in nuclear sclerosis. And talking about accommodative myopia, so it is mainly due to accommodative spasm. And talking about positional myopia, so it is mainly due to when the crystalline lens is placed in anterior chamber. So there are clinical varieties of myopia. Classification of myopia mainly congenital myopia, simple or developmental myopia, pathological myopia, and acquired or secondary myopia. So congenital myopia mainly present since birth and seen between 2 to 3 years of age, and there may be anisometropia, and which is maybe unilateral or bilateral, and mostly unilateral is common, bilateral is rare. And there is high degree of refractive error up to 8 to 10 diopter, and it is mostly associated with cataract, microphthalmos, aniridia, and microcornea. And we will discuss later about simple developmental myopia and pathological myopia. So here acquired or secondary myopia, it is mainly due to post-traumatic drug-induced pseudomyopia, space myopia, and night myopia. So here we are going to discuss about simple myopia, which is also known as developmental myopia, and it is most common myopia, and it mostly affect to 20 to 40% of population are affected, seen in school going age, and 8 to 12 years of is known as school myopia. So etiology, talking about etiology of simple myopia, there is axial myopia, which is mainly physical variation in length of the eyeball, and it may be associated with neurological growth during childhood. And there is curvature type due to underdevelopment of eyeball, and there is role of diet mainly due to vitamin A deficiency, and there is also role of genetics. If both parents are myopic, there is 20% of chances that children will be myopic, and if one of the parents is myopic, then there is 10% that children will be myopic, and if no parent are myopic, then there is only just 5% chances that the children will be myopic. And others reason are due to close work like watching TV, cell phone, and extra. And talking about clinical feature, so symptom, there is poor vision for distance, and astronomic symptom, there is headache, tiredness, and eye ache, and there is half shutting of eyeball, shut his whole eye or half eye for better accommodation. So what is the sign of simple myopia? That is prominent eyeball, myopic or large due to increase in anterior posterior diameter, and anterior chamber is deeper than normal. Size of pupil is large. Fundal examination normal or maybe crescent shaped. And magnitude of refractive error, generally 5 to 10 year children, it increases till 18 to 20 years of age, and there is increase of 0.5 to 0.3 diopter of refractive error every year. So let's discuss about pathological myopia, which is also known as degenerative myopia or progressive myopia, and it is mostly seen in 5 to 10 years of age, and it is also known as progressive disorders. Generally 5 to 10 years of age, if not corrected, it leads into adults, and in adult there will be high myopia more than 6 diopter. And talking about etiology, so there is a role of heredity, and there is role of general growth process. So role of heredity, what are the role of heredity? Familial, in family, in case in the family, if there is myopic, there is chance of children to be myopic. And sex, female is more than male. And in race, most common in Chinese, Arabs and Jews. In genetics, talking about genetics, so it is autosomal dominant condition linked to gene, and secondly, recessive inherited disorders, generally high myopic. And role of general growth process, so due to in nutritional deficiency, debilitating disease like hypertension, diabetes mellitus, and endocrine disturbances. So in the both cases, there is role of heredity, and in general growth process there is increased growth of retina, and there is stretching of sclera, which is leads to increase in axial length, and there is degeneration of choroid, and there is degeneration of retina, there is degeneration of vitreous. So talking about clinical features of pathological myopia, talking about symptoms, so there is defective vision, failure in visual function due to degenerative process, and by which there is uncorrected loss of vision, and there is musky volitins due to floating black of opacity in front of the eye, due to which degenerated vitreous, and there is difficulty in night vision generally seen in high myopia. And talking about sign, there is prominent eyeball, that is elongated eyeball, cornea is large, antechamber deep, pupil large, and magnitude of refractive error increases rapidly, 10 diopter to 14 diopter. Fundus examination, and optic disc degenerative changes in retina, choroid, and vitreous, and posterior phylum also. In optic disc, large pale temporal edge crescent myopic seen. Degenerative changes in retina and choroid. In macula, chororetinal atrophic patches seen. Foster Fuchs spot, dark red circular patches seen. Lattice degeneration, senile tract lesion. Cystoid degeneration seen at periphery. Total retinal atrophy at central. In vitreous, there is PVD, that is Weiss reflex.